Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Myself, Dr. Snigdhendu Pal. I'm consultant neurologist in Kolkata, attached to KPC Medical College Neurology Department and assistant professor in neurology.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
See, physiologically, our brain creates electrical signals to control different activities we do in day-to-day life, like what we think, when to move, how to move, how to decide a plan. Seizure is basically an abnormal electrical activity in the brain. It is also compared as electrical storm in the brain. So basically, seizure is abnormal activity in the brain, which may lead to unconsciousness, which may lead to convulsions, and patient may also feel disconnected with the surrounding.
What is epilepsy?
See, a person can have a seizure just one time in their lifetime, or it can be repetitive. Epilepsy is defined when a person tends to have repeated episodes of seizures. So, we stamp epilepsy when we are confident that this seizure is not just one time and it will be repetitive. There are many conditions which can lead to temporary episodes of seizure, like an episode of high grade fever or an episode of dyselectrolytemia. But when we diagnose it as epilepsy, seizures are deemed to be recurrent in those patients.
What are the different types of seizures and do they affect people differently?
Yes, there are many types of seizures. Broadly, seizures are classified as generalized and focal or partial. Generalized means the epileptic process involves the whole brain at a time, but in focal or partial epilepsy, it affects parts of the brain and then may spread to whole of the brain. So, in generalized seizure, patient has frantic, convulsive movement of all four limbs. Even they can mm, uh, feel disconnected with the environment, or in partial seizure there may be involvement of just a part of the body.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yes, there can be multiple reasons of epileptic attacks. There can be known lesions in the brain, like in the form of head injury, like in the form of tumors in the brain or infections in the brain. Also, in old age, stroke may can cause epilepsy. But it is also worthwhile to remember that not always there is a cause for epilepsy, and in most of the cases, in those cases, genetic background is deemed to be responsible for epileptic attacks, and genetic predisposition is found to be there.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yes, I previously mentioned some of the most common symptoms. It can be very
Yeah.
frantic convulsion of all four limbs to very subtle manifestation of epilepsy, like just staring in the environment, feeling disconnected with the environment. There may be some also weird sensation in the body, like some weird abdominal sensation, feeling terrified suddenly, or there may be jerking of just one part of the body, like a limb only, or face only. So there may be multitude of manifestations in epilepsy. One need to remember, generally epileptic attacks are sudden and they are brief, and they are just weird in some way, so that people behave abnormally. So
Yeah.
this, there can be varied manifestation of epilepsy, like I said.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, yes, stigma is very important because it is one of the main barrier in management of our patients with epilepsy. Stigma is a very social issue which affects epilepsy. See, previously people used to think that epilepsy is not a neurological disease at all. They used to think that it is an act of God, because in most of the time the manifestations of seizure or an epilepsy is very much sudden and very fearful. So people react in a way with fever, with fear, or some sort of ignorance also works. So stigma is an important factor surrounding management of epilepsy. Um, Stigma
Yes,
affects
yes.
management of epilepsy, as I said. Sometimes people creates a distance from a patient living with epilepsy. They get it hard to find a job, to find a partner. People hesitates living with a person with epilepsy, even don't allow their children to play with other children who have epilepsy. So stigma is a definite concern in our society surrounding epilepsy.
How does this stigma affect people with epilepsy?
Stigma affects a lot in the life of patients with epilepsy. Like I already said, they find it hard to land a job if they suffer from epilepsy. They find also hard to get a partner because people don't want to marry a person with epilepsy. People often hesitate to leave a person with epilepsy. They even don't allow their children to mm, play with a child who is suffering from seizures disorder. So stigma affects the life of a person with epilepsy. It creates a lot of stress in his or her life, which may actually exacerbate the disease itself. So yes, stigma is a very important and very disturbing issue in the management of epileptic patient.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
There can be varied triggers, and it also varies from a patient to patient. But there are some general triggers which exacerbates seizure disorders. Two most often factor are lack of sleep, and second is alcohol addiction. Apart from these two, skipping meals, having a irregular diet habit, high grade fever, other systemic illness like dyselectrolytemia, and also another important thing is skipping the dose of anti-epileptics. We have seen a lot of patients who are well controlled with medication, but as the medication needs to be taken long term, so people often ignore to take the medicine at regular time. So skipping anti-epileptic medications often exacerbates seizure disorder.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Uh, People should adopt a healthy lifestyle in the form of regular good sleep in the night, having a regular and healthy diet habit, avoiding addictions, etc. Can help them manage a better lifestyle with epilepsy. And most importantly, they should remember to take anti-epileptic medication as prescribed by the physician.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Safety, yes, relatives can adopt some safety measures to help prevent the injuries which are common in epileptic patients. Surroundings should be clear of cables or wires to help prevent fall. Uh, Sharp objects should be kept away from the patient with epilepsy. Sharp ends of the table should be covered with soft pads. People should avoid fire or water or height. Water means, I mean, pool, etc. Like when a epileptic patient is living alone in the room, he or she can use a micro oven rather than using a stove. Also, if can floor be covered with soft carpet, it will minimize the injury if patient actually falls during epileptic attack. So yeah, these are some safety measures relatives can adopt.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, thank you for letting me to share some information. Most importantly for the patients is to remember that epilepsy is very much treatable disease in neurology. In fact, it is one of the most treatable group of disorders in neurology. In almost two-thirds of cases, just appropriate medication will keep you seizure free, and in also rest of the cases, there is also scope of surgery nowadays. So don't feel hesitated. Uh, Contact your nearing neurophysician if you suspect that you are suffering from epileptic process, and also to remember that there is no stigma or act of God associated with disease of epilepsy. It is just an neurological disorder and it can be managed very well in present era of medical science.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.